Mr. DiCarlo, and Mr. Constantine. Thank you. Any objections? All right, thank you. Any conflict of interest on today's agenda? Okay, I'm seeing none. And just moving over to the update 4.1. Go ahead, Doctor.
Members of the Board of Health, acting chair of the Board of Health, colleagues, thank you so much for allowing me to speak today and share the perspective of the Public Health Service. Since we met the last time, I think it's reasonable to say that we've had increasing disease activity. When we look at the overall metrics of burden of disease, and that includes the number of people infected or currently identified as infected with COVID, the number of people who are currently hospitalized, the number of people who are dying, the wastewater data, taking that all together, I think that we could surmise that there's an increasing burden of disease. I think one of the challenges that we're facing with the increasing burden of disease is also the number of people being disqualified from working at healthcare institutions because they either have COVID or are the close contact of a person, and those individuals are being excluded, and that does affect the functional capacity of the institutions affected. We've at this point we've surpassed the 600 death mark in the Windsor-Essex Health District. I sometimes repeat myself, but there are certain items that are worth understanding. In 2020 and 2021, there were approximately 9,000 COVID-related deaths in the province. During that period of time, there were approximately 900 car crash deaths. So the burden of death is perhaps, using those crude estimates, perhaps 10 times as great. We're seeing on average between 2 and 4 deaths a week in the health district. Life expectancy across the country has decreased. I think the estimate that I most recently saw was the life expectancy is reduced by 0.6 years. So the burden of COVID-19 continues with our community. And my overall feeling is we have to work towards a plan to manage this increase in COVID or this additional burden of disease, but also think of ways that we can normalize COVID-19 as a phenomenon. It's not going away. The pandemic is not over. I wanted my colleague to put up a slide, which I thought might be particularly helpful to encapsulate our challenge. So I hope that all of you can see this. And I'm not a native of the Windsor-Essex Health District, so forgive me if my geography is a little weak. But this is a map of the Windsor-Essex Health District. What you will see is areas that are white and the areas that are brown, and then there are areas that are reddish brown, and then maybe darker brown or darker red. Each of these areas represents a metric of material deprivation, meaning this, that if you're in an area, if you live in an area that's white, you might see very little material deprivation. And if you live in an area that is dark red or captioned with the number 5, that's an area of significant material deprivation. This is a metric promulgated by the provincial authorities. The yellow dots represent deaths. And if one looks at where the yellow dots are, there are 2 things that are striking. One is that it would appear that the number of deaths are concentrated more in the urban core of Windsor and the urban core, or the more urban downtown areas of Leamington. And then there are some areas where we don't see any yellow dots at all. And if it's noticeable, we don't see those yellow dots in many of the areas that are white. In fact, I would be hard pressed to see one of those yellow dots in an area that's completely white. The reason I wanted to share this with you is that sometimes a picture says 1,000 words. Now, This is not the most sophisticated epidemiological and statistical analysis to put up a map, but the map tells us, I think, that material deprivation has disproportionately is disproportionately affected or affects people who die of COVID. Meaning that if you're going to die of COVID, you're more likely to live in an area of material deprivation, and that's an association. The crudest estimate that we have is that perhaps you have an 80% increased risk of dying if you live in an area of high material deprivation versus low material deprivation. A more sophisticated or elegant analysis would look a bit more at this and say, when we look at the different domains of socioeconomic status, that includes material deprivation, that includes if in fact there's a disproportionate rate of public assistance usage, residential instability, and age, and perhaps a greater distribution of individuals of ethnic minorities. We find that there are other factors that lead to a disproportionate percentage of deaths or a disproportionate effect. That includes age, which we might expect, but it also includes material deprivation, and it also includes dependency, or the whole idea that if you're on public assistance, you're more likely to experience death as a result of COVID-19. This is really not unexpected, although it might be striking, it's not unexpected. And the reason I wanted to share this today is that health is definitely or many times affected by access to medical care and the quality of treatment, but it is also substantively affected by the socioeconomic status of the people that we serve. And it appears to be true for COVID, based on the data in the Windsor-Essex Health District, but it also is true for other disease states which have been studied more robustly. And it's something that we collectively, both at the Public Health Service and as a community overall, have to work to address if we want to address this item. The second item I'd like to share is there's this concept of premature death. Premature death implies that people are dying before, at a time before perhaps we might expect them to die. Stated another way is in the COVID context, if it weren't for COVID, would this person live a long time? And those are particularly concerning deaths, the people who died prematurely because of COVID or any other disease. Our best estimate, our epidemiologist reviewed the data. Our best estimate is about half of all the people who die of COVID in the Windsor-Essex Health District are premature deaths. Now, how do we come up with that number? We arbitrarily set premature death at a man of under 75 and of a woman at 81. So in closing, I would say that that we have an increasing burden of COVID-19, or we have a significant burden of COVID-19 disease activity. We know that COVID deaths appear to be related to material disadvantage and other socioeconomic factors. And my message today would be, this is just not related to COVID, but disease states overall. And I think there are opportunities for us at the Public Health Service and the community overall to address these disparities in health. So thank you so much for allowing me to share my comments today, and I'm happy to answer any questions.
Thank you very much for all of those comments. Any questions? Okay, I can't see everyone, but I'm not seeing any questions, no hands up. Okay, thank you very much. So we'll move on then to 5.1, the regular board meeting minutes, the approval of the minutes for March 24th of 2022. Looking for a motion. Okay, Fabio. And second.
It's Gary, Tracy.
All right, you can resume the chair position. Is Gary
Oh,
Ash-
no, that was Gary
second.
Kushnap, I believe
All
that.
right, you're seconding the
that's-
minutes. All right, any questions or comments, concerns on the minutes? All right, then those are approved. Thank you. Where's our trustee leader? I thought maybe I was off the hook. Not so much. Oh, there you are.
Yeah, okay.
Okay, you're all set. 7.0 on the consent agenda. I'll stand down. Thank you.
Thank you very much, Tracy, for you go away on vacation for a week and then you got 2 weeks worth of work when you come back, you know, kind of nice. But thank you for taking over. Yes, well, before we move on to that, is there any business arising? Hearing none. Okay, we'll go to consent agenda. We have items 7.1, 1.1, 1.2, and 1.3. So for information, motion on consent. Ed, thank you. Aldo, second. Is there anything on the consent agenda that administration would like to highlight? Okay. See none, then on the motion, all in favor? Opposed, if any? That motion carries. Thank you. We have no resolutions to deal with today, members of the board. So we'll move into 8.0, which is a new business. First item under new business 8.1 strategic plan, and Nicole is going to bring that plan forward.
Can everyone hear me okay?
Yes.
Yes, we can.
Yep.
Okay, thank you. I've had so much difficulty. So thank you, Chair. So members of the board, our strategic plan, our last round of strategic plan actually expired at the end of 2021. So we have a plan to renew our strategic plan with a shorter term outlook. So what we're proposing is a 3-year strategic plan as opposed to the previous 5 years. And this will allow us to move through this transition phase while we're still in the pandemic, and also through renewal, transformation, recovery, whatever you'd like to call it. And then our hope would be certainly within a few years after that 3-year strategic plan expires, that that would be a better time to renew with a longer term outlook. The strategic plan is a requirement, as you know, within the Ontario Public Health Standards and as well within the HPPA. We have brought on a consultant, and I'll just introduce him. It's Harold Schroeder. So Mr. Harold Schroeder is going to work with our leadership team and our board through revising and renewing our strategic plan. Harold Schroeder is president and CEO of Schroeder & Schroeder Inc. He is an experienced management consultant and program project manager, representing 4 decades of experience working with boards, executives, senior management in both public and private sector organizations. Harold has served clients throughout North America and Europe on over 150 client engagements and written hundreds of project proposals. As head of various management consulting practices and large consulting firms, and as a project manager, he has been instrumental in building organizational capacity, developing staff, achieving accountability, and delivering on results. His professional designations include fellow certified management consultant, project management professional, certified human resource professional, certified health executive, and he holds a secret security clearance with the Government of Canada. His educational background includes an MBA, a Master's in Science and Health Administration, and a BA in Psychology, and a Bachelor of Science in Biology. So with that, I'll let Harold just say a few words, and he'll just provide a bit of an overview of our sort of our game plan or approach for strategic planning.
Thanks very much, Nicole, and it's a real pleasure to meet all of you. I know it's been a rough few years, and you've certainly been carrying the torch for a long time. I thought it might be useful just to briefly talk about a couple of things. First of all, the components or the framework of strategic planning. I know oftentimes that word is used differently by different people and organizations. The way we come at it is really from three components. The first component is really the positioning of the organization. So if you think of a puzzle piece or an overall puzzle, where does the public health unit fit into that overall picture, that overall milieu? What is the shape of all of those things? And what is the roadmap to actually fulfilling that particular positioning? And that typically is done with the board and senior executive. The next piece coming then out of that would be the operational strategy. So in order to implement on that strategy, what do you need to do differently operationally? Because if you're doing the same old thing, same old way, you haven't implemented anything. And that then gets into core processes, support processes, structure, all of those types of questions, and would typically involve kind of the senior management and department head type of level. And then coming out of that would be typically 6 to 8 what we would call change projects or transformation projects. We find if there's a lot more than that, you've gone too granular. If there's a lot less than that, too many things in one bucket, seems to be about the right number. And each of those would have a real solid justification in terms of what is the gap we're trying to address. What are some of the prerequisites? Why is this important? What are some of the costs, either one-time costs or ongoing costs? What are the benefits we're looking at for out of it? Roughly how long will it take? Is this a 3-year initiative or a 3-month initiative? And what are the 6 major steps around that? And then once each of those is described, you put it together in terms of an overall implementation plan, because clearly you can't do everything in the first week. So you need to layer it out over a longer period of time. So that's sort of the framework that we use. As far as the process is concerned, that would involve for sure engaging you in that first piece around the roadmap and the vision. And the process would involve collecting information from public health, as well as doing some short interviews with all of you, some additional surveying as well that would go out to targeted audiences. And then all of that is pulled together and digested into a 1.5-day planning workshop, a strategic planning workshop, using the framework that we have to make sure that in fact you're connecting all the dots and that you go from the vision to real implementation with accountabilities attached to that. So that's sort of in a nutshell the process, and I'm certainly happy to answer any questions you might have.
All right, thank you very much. Any questions or comments to our guests?
So,
Oh, did I hear someone? I can't see everyone. No, I guess we're basically, Harold, we're ready to roll up our sleeves and get to work and with you. And when you spoke about being in a line of fire over the last couple of years, there's no doubt that everybody here and some of our responsibilities obviously have been kind of shuttered a little bit because all hands were on deck on the pandemic itself. But moving forward as a group, I think, to reestablish what I guess we're all trying to figure out what the new norm's going to be moving forward. And so there's certainly a lot of things that are trying to balance out with the unit, in particular with our opioid crisis as well, that is a huge issue for us, and then getting into a safe injection site, which is new territory for all of us here, and so certainly we're going to be looking forward to working with you hand in glove and kind of set a new course or clarify what a new course is certainly going to be.
I think it'll be very interesting and potentially revealing. One of the real benefits of going through this is not just the ultimate outcome, but in fact getting everybody on the same page through this type of process.
All right. So if there's no further questions, we certainly thank you for coming on today, and certainly we're looking forward to working with you as this project comes to fruition.
Thanks very much. I'll jump off then.
Okay, thank you.
Bye now.
Okay. Move on to the annual report. Nicole, you're still on?
Yep, I am still here. I'm having trouble. I can't turn my video on, so I'm actually going to turn it over. Eric's going to share his screen and walk us through our annual report. So thanks, and actually, which is appropriate because our communications team did, the work pulling our annual report together. We actually haven't, because due to the pandemic, we haven't produced an annual report in a couple of years. So we're very happy to present our 2021 annual report. And Eric, if you can just go through next page. So for those who are been on the board for a while, you'll recognize this format. We previously moved to a web-based annual report in 2018. So it's very much the same format. You can go to the next page, Eric. I did have some slides, but unfortunately I'm not able to pull them up. But it includes, so this is live now on our website. And we just highlighted a few stories. So obviously there's a nice message from our chair. If you can go to the next page, Eric. Some greetings from myself and Dr. Nesathuri. We can go to the next page. And as we have done in previous years, we tried to just capture and highlight a few of the programs that represent, major projects or a significant amount of work for our health unit. Obviously, our COVID response in 2021 continued to be a significant amount of work. We actually experienced 3 waves of COVID in 2021. And I'll try to just highlight, we had over 17,000 positive cases that our case and contact team followed, as well as around 33,000 contacts that our case and contact team also, would contact, monitor, provide daily or frequent calls to. So a significant amount of work in 2021 related to COVID continued. We experienced 351 deaths that were reported related to COVID-19 in 2021. And declared 456 outbreaks specifically just related to COVID-19, and dismissed 1,112 school cohorts over the 2021 year. We also wanted to highlight that while our school team was very busy, and I see Christy in the corner of my screen, so and Felicia, who oversees our case and contact team, and Christy, our school team and environmental health. So a lot of work certainly related to schools and COVID-19 last year, but we still managed to focus on a few other items, in particular mental health. They did launch some bullying awareness in partnership with the schools. So where we could, we did try to focus on other topics besides COVID-19. You can just scroll down a little, Eric. We also captured our enforcement. So that had been a lot of questions in 2021 related to our enforcement of COVID-19. We actually responded to over 4,000 education requests and complaints, and that's just specific to COVID-19 and the ROA in 2021, and issued 174 tickets. And as you've heard us state many times, education is always the goal. So by the time we get to an enforcement to a ticket, there's been a lot of visits and a lot of education and a lot of discussion before that point. And 174 is quite a lot. As well, I'll just highlight briefly, you can scroll down, communication. So our communications team, which was expanded well beyond our actual core communications folks. We had individuals pulled from many teams into our communications department to bolster the work throughout COVID. And you can see there, we had our call center, which most of our calls related to COVID were centralized through a general call center, and they responded to over 20,000 calls over the course of 2021. As well, you can see our website continued to do really well, and the team did a phenomenal job continuing to update and provide timely information throughout the course. Go to the next. And I'll try to move as quickly as possible. COVID vaccination, obviously a big program for us. And, certainly if there's questions, Christy, I see Christy there, and this little paragraph isn't going to do justice to the entire, the work of everyone. But the WeChew worked very closely, of course, with hospital partners, EMS, our mobile CREST team, and others to deliver vaccines over the course of 2021. If you'll recall, in January was actually the beginning of our vaccination program when we started with long-term care homes. And over the course of the year, we administered 792,385 COVID vaccines. And we also were part of 6 mass vaccination sites that opened and closed over the course of 2021. Go to the next page. So we also in the annual report want to capture some of our other important work that we did try to continue throughout the year, and our opioid response is certainly a big part of our work. Chair McNamara mentioned in the beginning our work on the CTS, so we continued that work and completed a site consultations through 2021. As well, our team continued to focus on the Ontario naloxone program. So this is a program where the health unit trains community partners and agencies in naloxone, and they distribute to their clients within the community. We did have 4 new partners come on over the course of 2021, and in total have 18 agencies that are part of this program. And collectively, they distributed 1,065 naloxone kits through that program, and trained to 2,820 individuals. And the last, I'm not sure if that's a timer for me to stop. The last program that we wanted to highlight was the Ontario Seniors Dental Care Program. So for board members, you may remember that this program actually is new, and it launched in 2020 and then quickly was shut down due to the COVID-19 pandemic, and our dental office is actually shuttered for a period of time. So 2021 was actually the first full year that this program was in operation. In total, we've welcomed 870 seniors to our client roster within the WeChew. And as you may be aware, we are the only service we're the only provider delivering this service within Windsor-Essex. And in 2021, we had 398 new patient exams. These were new clients that came through our doors in 2021. Over the course of 2021, our team had 3,349 appointments related to the Ontario Seniors Dental Care Program. And as you may recall, we did hire 2 full-time dentists as a result of this program, and extended our hours in our Windsor clinic to 8 p.m. in order to accommodate more clients. Our dental team also continued to support the Healthy Smiles Ontario program throughout 2021. And in 2021, we had 4,015 appointments related to HSO, and which covered 1,998. And lastly, not lastly, so as usual, our financial information is included in our annual report. And if you can go to the next page, Eric. I think it's been mentioned, obviously, there are a lot of programs that are not up and running as they would have been prior to the pandemic, but there was still a lot of work that's continuing in our other public health programs. So we just highlighted some of the statistics that we would normally report. And for 2021, so you can see our smoking and vaping enforcement officers were still out there. They were doing both ROA inspections and enforcement, as well as those that fall under the SFOA. Our food handler was still, food handler training still continued. You can see our inspection team has been quite busy. They completed their seasonal housing compliance inspections. We had quite a number of reportable sexually transmitted and blood-borne infections, and our Felicia in our infectious disease department clinical services team follows up on those, and as well, still a high number of animal exposure investigations, which require an immediate response from our environmental health team. So definitely a busy year in 2021, and it certainly doesn't capture all of the excellent work that the health unit and the staff here at the health unit, but I think at least give some highlights of the work that's been done past year. And I'm certain if there are questions, anyone from the leadership team would be happy.
All right, thank you, Nicole. Any questions or comments to Nicole? Ed, go ahead. You're muted, Ed.
Can you hear me?
Yes.
Okay, thank you. Thank you. My question to Nicole, I know I look at the annual grant and the one-time grant. The one-time grant, it's something unusual because of the pandemic we have. Can you foresee, or at least tell us whether you have some information from the ministry that the one-time grant might be extended a little bit longer because of COVID? Seems like we are not out of it. Any idea?
Yeah, I can start if you can hear me okay, and I'd probably ask Lori to expand. I think you're referring to the one-time grants we received related to vaccine and COVID response in 2021. So we do have a sense that those will be, we've been assured that those will be continued in 2022. Ed, so we are expecting that we will have one-time grants related to COVID response, vaccine, as well as recovery. So that has been indicated by the ministry to us, and as you'll recall, we've included that in our budget. So, and we don't anticipate that won't be funded. 2023, I think, is probably a bigger question. And Laura, I don't know if you want to add at all.
Okay.
So yes, in regards to 2022, Ed, our annual service plan that was submitted at the beginning of March did include requests for support on extraordinary costs associated with COVID, including COVID vaccination. As all of you recall, we put in the budget, and there's an acknowledgement from the ministry that, again, what happens with COVID is very fluid. Things keep changing. So our quarterly reporting, which will start in the second quarter of 2022, will allow us the opportunity to true up and advise the ministry as to updated costs associated with COVID. But again, for 2023, we have not received any information that would suggest that there would be COVID funding then. And again, I think that's something that discussion will likely evolve over the course of the next several months.
Nicole, just one question here I have on my mind. Actually, I've been thinking about it. I'm kind of embarrassed to ask. The House unit had been doing a super job. There's no question about it. I think we all realize we did the best we can with the limited resources we have. Yes, we did a great job. Now the pandemic is kind of, hopefully it'll be behind us soon. If we ever have a pandemic, would you still handle it the way we did? Did we learn any lesson that, oh, we should have done this or we should have done that? Or we still stick to the basic principle and deal with it the way you did?
I think those are very good questions. And I think, we haven't done a comprehensive evaluation of as you know, it's been sort of run forward and respond, and we've been in response mode for quite some time. But certainly we will evaluate our strategies, and we constantly do review and revise. Every director here can speak to that. We constantly look at what we're doing and adjust and change. but more of a comprehensive review or evaluation of our implementation throughout the pandemic, we haven't done. But also keep in mind that there were constant changes from the ministry and constant changes in direction throughout the pandemic as well. And so, again, you're creating plans, recreating them. But I guess to answer your question in short, and Dr. Nasseri may have something certainly to add to this, but to answer your question in short, we do things differently next time. Certainly, I think we always strive to do things a little bit differently and better, and we've learned a lot. I have not experienced a worldwide pandemic, and I don't think anyone in this, in this call has. And so we will hopefully learn a lot from this and have that in our playbook for, the next time around. Hopefully that's not in our life.
Nicole, you answered my question brilliantly, honestly. And one thing I jumped in too fast. We haven't done any evaluations, so maybe my question was too quick. I apologize for that, and hopefully we'll be much better ready if it ever happen again with a different kind of disease. Anyway, thank you, and thank the Health Unit in general, and to our medical officer of health. Thank you.
Thank you.
All right, any further questions to the annual report? If not, then I'll ask for a motion to receive the report as presented. Judy, thank you. Support? Joe? On the question, all in favor? Opposed, if any, that is carried. Thank you. All right, Nicole, you're still on. It's the CEO's quarterly report, and that's from Jan 22 to March 22, and that's on page 35 of your agenda package.
So for members of the board on page 35, certainly able to answer any questions if you have any. We had 2 items that were highlighted within the report, and so of course that would be related to the financial. COVID-19 vaccination and response continues to be unpredictable, and as well we continue be in a continuity of operations, so we have redeployments, et cetera. So that's been highlighted in the report. As well, you'll note we also had one unplanned termination that is documented in the report as well.
All right, any further questions to Nicole on the quarterly? Hearing none, then a motion to receive the report as presented. Gary, thank you. Ed, thanks. All in favor? Opposed, if any, that is carried. Thank you. All right, 8.4, members of the board, that's the Alpha Annual General Meeting. That's scheduled for June 14th, 2022, and that's going to be, again, this year virtually. And that's located on page 37. So obviously there's time still, Nicole, for those who would want to participate.
Yep, and as with the previous Alpha, we're encouraging any board member that's interested to participate. This is the annual general meeting, so this is where resolutions are brought forward, and it's a bit of a bigger meeting than others. It is still virtual, so very convenient. And if you are interested, just let Leanne know and we'll get you registered. I believe she did send out a hold for everyone in their calendar in case you are interested, and you can just ignore it if you're not. As well, I'll just jump into the other item that's below that, which is the Alpha Fitness Challenge. So those have been around for a little while, and a member of our Board of Health might remember they used to do a coordinated Alpha challenge, which to get everyone moving at the same time. And in previous, when we were meeting in person, we would go for a joint walk or something to that effect. This year, the bar is a little lower. And so they're just promoting 30 minutes of activity through some time in the month of May. So expect some, we'll be promoting that obviously within the health unit and with our staff, and expect some promotion to you as board members to get moving and report your movement to us sometime throughout the month of May. And hopefully we'll have some nice weather, so it'll be enjoyable to get outside and move.
Okay, any questions? Again, if members are still interested in participating in the Alpha, as alluded, let Leanne know. Okay, we'll move on. We've got correspondence. We've got the Simcoe Muskoka Public Health. That's letter to the Honorable Christine Elliott. And it's a response to the opioid crisis. And our recommendation is for support of Simcoe Muskoka Public Health, the letter. Moved by Judy. Do I support Ed? Thank you. Any questions or comments? Hearing none, all in favor? Opposed, if any, that is carried. Thank you. All right, we'll move on. Item number 10 is the Committee of the Whole, the closed session, and it's in accordance with Section 239 of the Municipal Act. We're going to have a motion that to move in Committee of the Whole. Judy moves and supported by, let's see, everybody. Ed, thank you. On the motion, all in favor? Opposed? That's carried. Thank you. We'll move into closed session. Leanne, let me know when